Hello, a very good evening, everyone. Thank you for joining in. I am Dr. Ruhi Agarwala, co-founder of Functional Medicine Clinic. And so here we are with another series of live Q&A session where it's an effort towards creating awareness about functional medicine and also answer some of the burning questions that most people have. So our team has already collected questions from those who wanted to attend the session, and we will be taking those questions one after the other. I have Dr. Ashwani Garg with me, co-founder of Functional Medicine Clinic. So
Good evening, everyone.
yes, let's get started. Okay, so let's start off with some context because we'll be talking about a lot of diseases. So, what is functional medicine? And how is it different from so many other kinds of, ways of treatment that's currently available?
Okay. So functional medicine is a methodology that helps to give the framework to understand the root cause of the problem. Okay. So in this, we look at the patient more holistically rather than just looking at the label that the patient carries, maybe IBS. But along with IBS, there are 10 more things: the sleep, the skin, the food allergies, 10 more things are there as a problem. So we don't really worry about only about diagnosis. We look at the person as a complete. Then we do a detailed testing, very, very advanced kind of testing, which could be nutrition, which could be toxicity, which could be microbiome, which could be organic acid test, which could be hair mineral assessment. Lot of detailed testing based on not that everything is required for everybody, but everybody that we work with, we want to know a detailed marker. Then we combine these together, the patient problems plus the markers. Then we come up with the solutioning to address the underlying causes, and effort is to bring health to the patient so that disease start going away. Okay, so we are very, very holistic when it comes to natural solutioning. Now, solution can come from uh, the good food, good lifestyle, can come from the microbiota modulation, can come from naturopathy, can come from nutraceuticals, can come from augmenting the mitochondria, can come from detoxification. Now, this detoxification that we talk, typically detoxification that is done in convention in the alternate system is mostly to do with the gut cleansing, which is great. But we look at a cellular detox, a very, very aggressive kind of thing to really pull out the disease out of the body. So that way we are very, very aggressive and very, very detailed and comprehensive into our planning.
Right. So, in short, functional medicine is not just another medicine. It's a way of thinking. It's an approach that looks at the root causes of any health issues. And then how do we identify what is going on? We use detailed investigations. We use the patient's whole body sign and symptoms, and we work on everything, all kind of imbalances in the body, and it's not just restricted to just the deficiencies or just the liver function, but everything that the whole body is basically comprised of. So that sets the context of our further discussions. Now, today we very commonly see thyroid disorders. I would say at least one person in every household is struggling with a thyroid disorder. Okay. And they are on thyroid pills, okay, which is basically pill for life. Now, can thyroid be really reversed? Can thyroid disorders be really reversed?
Okay. First of all, we need to define the problem a little more specifically. Now, today, high TSH means hypothyroidism. Now, how do we know the gland output is good or bad, enough or not enough? It is based on T4 test, which is the large part of the gland production is T4. In most cases, even the patients, when they look at their reports, T4 fairly in a decent level. It's only high TSH. Okay, so can we say if TSH is high and T4 is normal, can we call this a hypothyroid? Maybe not.
Yeah.
In our understanding, high TSH is generally associated with Hashimoto thyroiditis, where there's some level of autoantibodies has started developing or some inflammation is there. Now, taking thyroxine pills reduces TSH for sure, but does not fix Hashimoto's. Now, to fix the Hashimoto's or naturally bringing TSH down is by reducing the inflammation in the body or bringing down the autoantibodies. Now, if we eliminate what is causing those autoantibodies to be high, could be gluten, could be dairy, could be chronic infections, could be toxicities, could be deficiencies in the body. Slowly, gradually, over a period of time, these autoantibodies start falling down and they can come well within the range over a period of 9 months, 1 year. So to answer this one question, can we bring down TSH within limit or can we bring down thyroid antibodies? Yes, certainly we can do that. Okay. So not necessarily every person is actually hypo when TSH is high. So this is very important for all of the people who are listening to us to understand that.
Yeah. So also, when it comes to thyroid markers, right? Don't just look at your TSH levels. Look at the complete picture. Look at T3, T4. Also look at the thyroid antibodies. And if you really want to address what is really causing the the thyroid disorder, look at the complete blood profile, where you can look at the complete nutritional profile, because if your thyroid gland is not able to make the hormone, it's because of certain deficiencies. So unless you look at your nutrition profile, you'll not understand that. Look at your how good is your liver function. Look at the heavy metal toxicities, because often they play a very important role in the in the functioning of the hormone, their ability to work on the target sites, etc. So definitely thyroid disorders can be reversed. Always rule out autoimmunity. Uh, so, and the thyroid disorders, like it can be Hashimoto thyroiditis, it can be Graves, which is a condition of hyperthyroid. Now, there is also something called Hashimoto thyrotoxicosis. So, you want to share talk more about that?
So it is again an auto